morning, everyone, and thank you for attending our presentation. We are Enzymatic, and I am Sam, and with me is Shikhar, Steve, and Becky. Our talk today will consist of a general introduction, followed by what we believe to be a large market need. We'll then talk about our business plan and overall process design to try to meet that need. We'll then touch upon some environmental, health, and safety concerns that we've considered, and follow up with a detailed economic analysis, as well as general conclusions. So throughout this whole process, we've all worked collaboratively. However, we each have kind of taken the lead for a certain aspect. I've worked on the business and market analysis, while Shikhar has led the detailed technical analysis, Becky has led the detailed economic analysis, and Steve has led the safety analysis, as well as in-depth engineering calculations. So now we'll jump into the details as to what we believe is a large market need. And that market need is the global blood crisis surrounding blood transfusions and blood types. Approximately every 2 seconds, a blood transfusion is required in hospitals. However, 1 in every 19,000 patients receiving a blood transfusion actually receive the wrong type of blood during their transfusion, which can ultimately be fatal. So the one and only way to prevent this from ever happening in a hospital setting is to give all patients O-negative type blood, which is the universal donor blood. So a little more detail as to why giving the wrong type of blood to a person can be fatal is that the immune system attacks any red blood cells carrying antigens unrecognizable to the human body. So for example, if a person has blood type A, then they also have naturally occurring anti-B antibodies in their plasma. So if that person with blood type A is accidentally given blood type B during their transfusion, then those antibodies will fight against the blood, and that's what can lead to the potentially fatal response. Fortunately, Enzymatic has developed a foolproof solution in preventing this potentially fatal event from ever occurring, and that is to enzymatically convert A and B type blood to the universal donor O type blood. So before developing our in-depth solution for this, we looked into whether or not this had been attempted before, and we found that in fact it has. However, due to significant roadblocks, the production of enzymatically converted O-type blood has never been economically feasible, and therefore to this, currently there is no enzymatically converted O-type blood on the market. Enzymes such as alpha-galactosidase, for example, only cleave the B antigen, and it honestly requires such an impractical amount of enzyme that it's just not economically feasible for the conversion process. Additionally, we found that cleaving the A antigen from blood cells is much more complicated than the B antigen because there are 2 subtypes of A antigens on red blood cells. For example, enzymes such as alpha-N acetylgalactosaminidase only cleaves one of the subtypes of A antigen, and this wouldn't be considered a successful conversion because in order for it to be converted to O-type blood, both subtypes must be removed. But even with these roadblocks, Enzymatic feels that there is big enough motivation and need to continue forward with the project in developing a business plan and process. And one of those reasons is that O-negative type blood is the blood type in biggest demand in hospitals, and this is for a couple reasons. The first reason is that providing all O-negative type blood eliminates blood typing during emergency situations. So if patients are rushed in, for example, after being in a car accident, instead of needing to take the time to run a blood test, they can quickly administer O-negative type blood. Additionally, giving O-negative type blood reduces human error. As I mentioned, occasionally transfusions result in the patient receiving the wrong type of blood, and this is often a result of mislabeling or packaging of the blood. So just converting everything to O-negative type blood would significantly reduce that error. Additionally, converting all blood to O-negative type blood allows donated blood of all types to be used and reduces waste. Blood actually has a shelf life of 42 days. So after that 42 days, unfortunately, if the blood supply in the hospital hasn't been used, it must be discarded. So converting everything to O-type blood allows hospitals to give the blood to anybody. And finally, the top priority of Enzymatic's process is to ensure the safety of patients receiving blood transfusions. So now we'll get into a little more detail as to how we plan on meeting this market need. And we have decided to start our company in Japan, as the need for O-negative type blood is especially high. Only 0.15% of the Japanese population has O-negative type blood, so they often have very little supplies of O-negative blood in hospitals. Specifically, we'll be located in Chiba, Japan, which is in the outskirts of Tokyo. And as we know, Tokyo is a large shipping port, meaning we can gain easy access to any raw materials that we might need to have shipped in. Additionally, Japan is a developed country with very stringent blood testing regulations, which makes our job of ensuring that the blood is safe to give to patients a little easier. And the ultimate goal is to ensure that the blood is free of any potential bloodborne pathogens. And finally, we anticipate an approval time of less than a year from Japan's Pharmaceuticals and Medical Devices Agency. And we also anticipate clinical trials for this process to last about 3 years in Japan. Additionally, about 2 million liters of blood are donated per year in Japan. Again, keeping in mind that likely a very small amount of that donated blood is in fact O-negative. To enter the market, Enzymatic has chosen a production goal of 200,000 liters per year, which is about 10% of Japan's donated blood market. And this breaks down to a production goal of about 600 liters per day. And finally, we plan to accomplish this by partnering with the Japanese Red Cross Society. As they're the sole distributor of donated blood in Japan, we plan on purchasing both blood and plasma from the JRC after they have conducted their stringent blood testing. We will purchase the blood for $185 per unit, which is about 500 mils of blood. Additionally, we will buy the plasma for $210 per unit. And although we will be buying the blood after the JRC has conducted their blood testing, before processing, we will also do thorough blood testing of the blood.
So as Sam had mentioned, prior attempts have been made at blood conversion. However, each of these processes has either been highly inefficient or unable to produce purely O-type blood. However, here at Enzymatic, we've successfully designed a process that is able to integrate a conversion method and a novel separations technique in order to convert both A and B blood types into O-type blood. So our overall process can be broken down into 4 main steps, and that's beginning with the enzymatic conversion from A and B blood to O-type blood. Following this, we'll have an agglutination step where we plan to clump out any of our remaining unconverted A and B cells. And then to remove out those impurities, we'll have a hydrophoretic filter. And finally, before we send our product off back to the Japanese Red Cross, we're going to have a final product analysis. So our first step, as I mentioned, is the enzymatic conversion. Now this uses an enzyme known as endo-beta-galactosidase, which is a family 98 glycoside hydrolase derived from Streptococcus pneumoniae. Now this method was first validated by Dr. Stephen Withers, who's a professor at the University of British Columbia in Canada. And what's unique about the enzyme used in this process is its ability to convert both A and B cells into O cells. And it does this by cleaving the A and B sugars, as you can see on the image right there. However, the problem with this process, as with many processes that have preceded it, is that it's only 95% efficient. And we've developed a process that can fix this problem. However, before we can do that, we want to make sure that we remove our enzyme from our conversion process. So we're planning on using 4 wash cycles of a saline solution in a 1:4 saline to blood volume ratio to clean it out. This will be centrifuged at 1,000 RPMs, and then it'll allow for separation of our enzyme, and any enzyme that we removed can then be recycled back for future batch processes. So as I mentioned, the enzyme conversion is only 95% efficient. And now this may seem like a large number, however, it's really not for the human body, as it's highly sensitive to any impurities in the blood. Thus, it was very vital that we find a process that can remove out those impurities. So we're using a process that's used similarly in blood typing. And that process is known as agglutination. And this occurs when an antigen is reacted with its corresponding antibody, causing the blood to clump out, also known as agglutination. Now, the body's plasma naturally contains these A and B antibodies, and this is ideal for our process as we plan to add it in a 2-to-1 ratio of plasma to unconverted blood cells. This will allow us to clump A and B unconverted cells and remove them out for future processes. So we're going to have two processes, one A stream and one B. So for our A cell conversion process, we're going to use B antibodies to clump the A cells. And for our B conversion process, we're going to use A antibodies to clump out those B cells. And similarly to before, how we removed the enzyme from the conversion process, we're going to use a centrifuge again to remove the plasma from this. So to remove the impurities, we're going to use a hydrophotic filter. Now, this is a commonly used cell separation method composed of a microfluidic device. It is a slanted surface containing many slanted and filtration obstacles, and this allows for smaller particles to fall through, while larger particles, which will be our unconverted and clumped A and B cells, to flow out through the side. And we anticipate that our O cell type size, the product converted, will be 6 to 8 microns, and this is ideal as we can adjust the pore size to match that description, allowing us to purely collect only O-type blood. And the best part about this is that it operates at 99.9% efficiency, so we're really limiting any impurities that we put into the human body. So finally, we're going to have our testing process, but before we can do that, we want to make sure that we cool our blood down from its reaction temperature of 30 degrees C, which is optimal for its conversion process, down to 4 degrees C, which is optimal for storage. And then we'll test our blood per many of the recommendations sought out by the Japanese Red Cross, mainly for things like bloodborne pathogens such as HIV, HPV, and syphilis. And as Sam had mentioned, we're going to test our blood at 2 points. We're going to test it once when we receive our blood from the JRC and once when we sell it to the JRC, back for packaging and labeling. So our overall process is going to look something like this. We're going to have beginning 2 holding tanks containing blood and buffer. And along with that, we're going to add enzyme into our agitation reactor, which is going to complete our conversion at 30 degrees C. Now this process we anticipate is going to take about 13 hours to convert. Following this, we'll have our centrifuge to remove out the enzyme. And the enzyme will then be recycled back into a holding tank back for future batches. Once we've removed our enzyme, we anticipate that'll take about 4 hours. But then we'll transfer it into another mixing tank where we'll add our plasma in here. And even though this process may be pretty instantaneous, we still want to give it about an hour and a half to 2 hours to make sure that we do clump out any remaining impurities. And then we'll send it off into another centrifuge to remove out the plasma. And then finally into a hydrophotic filter where we'll separate out any of those impurities. And this process takes about 2 hours before we finally put it into our final holding tank at 4 degrees C. Now this overall process takes just under 21 hours. And as I mentioned before, we're going to have cleaning between each step, and we're going to have 2 separate processes that look just like this, one for our A conversion to O and one for our B conversion to O.
So, the Food and Drug Administration requires that all pharmaceutical equipment is required to have scheduled cleaning and sanitizing. So, because we have a batch process, we can clean all of our equipment between each batch. Sodium hydroxide has proven to clean and sanitize proteins, nucleic acids, and most viruses and bacteria. So we plan on cleaning our equipment with sodium hydroxide solution. Sodium hydroxide concentrations and contact time will be determined after a few test batches because we're not going to be sure of how much contamination will come from previous batches. After that, we'll wash with a very low concentration of hydrochloric acid to neutralize any of the remaining sodium hydroxide. We're also going to integrate some safety measures per the Somatic PCS7 control system. This will allow for automated addition of raw materials as well as automated cleaning process. This will also allow us to change inputs depending on the size of our batch. We're also going to have some temperature sensors. As we said before, our conversion process is most efficient at 30 degrees Celsius. So we'd like to keep it there, and if it does rise over 10 degrees Celsius or so, our blood will start to degrade, which obviously we don't want. We'll also have some level transmitters, which will help us vary the batch sizes as we have different inputs. So as a company, Enzymatic strives to be as environmentally conscious as possible, as well as safe and healthy for all of our employees. That being said, some considerations environmentally. Of course, energy consumption is number one. We want to limit our energy consumption, and to do that, we are limiting the use of our heat exchangers as well as our pumps. Those will only be in use when the process gets to that equipment. Our water consumption is constrained by the reaction process itself, so we can't really constrain that at all, but we will have some wastewater and solid waste byproducts removed and treated off-site. Our solids, liquids, and byproducts will all be biohazardous materials, so we must have this external service meet all EPA, OSHA, and DOT standards. Now you may ask, we're in Japan, why do we care about the US regulations? Well, we do plan on expanding internationally in the future, so we want to follow these fairly strict regulations. We are also far below any reporting limits that the EPA requires for greenhouse and hazardous gas emissions. As I said, Enzymatic strives to be as healthy and safe as possible for all employees, so we will have mandatory quarterly safety training for all employees. We will also have a personal protective equipment program to determine what PPE should be used in which process throughout the facility. We will also perform some occupational noise exposure studies, as the centrifuges and pumps may get pretty loud. This will determine the individual employee's need for hearing protection throughout the facility. As I said, in our cleaning process, we have some pretty harsh chemicals, so we're going to have a chemical safety program to ensure that all of our employees have safe chemical handling skills.
So now moving on to the economics of the process, I would like to note that all of the prices are currently listed in US dollars for ease of understanding. However, they have been adapted from the Japanese yen. So to start with our raw material consumption, as you can tell by the process based on what Shikhar said, we do not have a large variety of raw materials. However, the ones that we do require are quite expensive, most notably our red blood cells, the enzyme, and the plasma for the agglutination step. Our red blood cells we'll be getting from the JRC, and as we will be partnering with them, we will have a discount in our prices for that, for the 200,000 liters that we will require annually. The endo-beta-galactosidase is our enzyme that we'll be using for the enzymatic conversion, and this is our most expensive raw material per volume. As Shikhar said, we will be using an enzyme washing process which will allow us to recycle this enzyme 15 times. This reduces our annual quantity to 5 liters per year, which reduces significantly the amount of annual cost that we will have for that raw material. Our final expensive raw material is the plasma, which we'll be using at a 2-to-1 ratio for our agglutination process of the unconverted red blood cells, which results in a total annual cost of $94.3 million. So next, for the equipment that we'll be using for this process, it's a fairly simple equipment process, as we'll only be using reactors, holding tanks, centrifuges, and the hydrophoretic filter for the cell sorting of the agglutination step. However, as we'll be using 2 completely separate processes for our type A and our type B blood, we will require double the amount of equipment, resulting in a total equipment cost of approximately $1.6 million. Using a factor of 3.2 of our equipment cost, we'll have an inside battery limit of approximately $5 million. So our installed capital cost includes our inside battery limit, our outside battery limit, our engineering and construction fees, as well as our contingency cost. Our inside battery limit, as I mentioned, is a factor of 3.2 times our equipment cost. Our outside battery limit is 40% of the inside battery limit, while the engineering and construction costs are 20% of our inside battery limit, and the contingency costs are 10% of the sum of the inside and outside battery limit, resulting in a total installed capital cost of approximately $10 million. So the manpower required to run this process will be running 8,000 hours annually, which accounts for 330 days of operation and 32 days of maintenance and holidays. We'll be running on a 4-shift per week schedule, as we will be running as a 24-hour operation in order to receive the freshest blood into our facility, convert it, and return it back to the JRC with the longest shelf life possible for their patients. Each shift will consist of operators and a supervisor. We'll have 8 operators per shift for a total of 32 operators on our payroll. The 8 operators per shift will be split into 2 groups. We'll have 4 operators per process, which accounts for 1 per main step in our enzymatic process. They'll be paid the current annual salary of a manufacturing operator in Japan, which is approximately $24,000. For the supervisors, we'll have 1 per shift for a total of 4 supervisors, and they will also be paid the current salary of manufacturing supervisors in Japan of approximately $49,000. Accounting for a 45% overhead for our employees' insurance and payroll, etc., will have a total labor cost of approximately $1.4 million. So next, our cost of production is mostly made up of our variable costs, which is our raw material costs, our utilities, and our waste disposal, while our fixed costs account for our labor, maintenance, taxes, insurance, and corporate overhead charges, for a total of $98.7 million. However, you can see from the pie chart on the right that 96% of this is made up of our raw material costs, just due to the very expensive raw materials that we will be acquiring. So what is the anticipated income of this project? We'll be selling our enzymatically converted blood for $270 per unit. Unit is 500 mils, which gives us a total of $102.6 million in revenue. Additionally, we will have a byproduct revenue stream, which accounts for the 5% of the agglutinated blood that we will be selling to a research facility for $20 per unit who are currently doing blood typing research. These 2 streams together give us a total revenue of $103 million. Less our raw materials will have a gross annual margin of $8.7 million. Accounting for the remaining costs of production and taxes, we will have an annual net profit of $2.8 million. So what is the return on investment of this process? As I mentioned, we will be selling our enzymatically converted blood for $270 per unit, and our byproduct of the agglutinated blood for $20 per unit. These 2 revenue streams together give us a simple payback period of our installed capital cost for 3.6 years. Accounting for depreciation of our equipment and time value of money, we'll have an internal rate of return of 20%, and we will turn a positive net present value in 5 years. The figure on the right shows our net present value over the course of the 20 years of the operation of this process. So now, just to wrap some things up, I want to make some notes on the ethics of blood transfusions as well as how it relates to the Japanese blood culture. There's a very strong blood culture in Japan related to their blood type, and this began due to the study of temperament through blood type that was published in 1920. However, this trend faded due to lack of scientific evidence by the 1930s. However, in 1970, a journalist revived this trend and has remained so to this day despite the scientific evidence. A personality psychologist has made a hypothesis that the blood typing popularity in Japan has been related to the desire to appear as a more diversified population. So what does this blood typing popularity really consist of? The blood types have been connected to temperament, personality traits, compatibility of partners, as well as diet and exercise programs. This is very similar to the US version of a horoscope. So as such, more than 90% of the Japanese people are aware of their blood type. So a question may be as to the fact that they're very aware of their blood type, how does this affect their view on blood transfusions. However, it does not. Since 2008, Japan has used over 90% of their donated blood supply due to blood transfusions, and they do not have a problem with using a blood type that is not their own, as currently in Japan, AB type blood, which is the universal receiver, currently receives blood transfusions from A, B, AB, and O.
All right, to sum things up, Enzymatic's proposed process will decrease the transfusion error rate. We will prevent blood waste leaving hospitals, as we will have more O-type blood and less unused A or B-type blood. Our novel agglutination process will ensure the purity of the blood of our product, the O-type blood. And as you may know, Japan has just had a few earthquakes. And if Enzymatic were up and running at the time, we would have been able to be there to supply the people with our universal donor blood and hopefully save some lives. Hopefully in the future, if this does happen, we will be able to do that. Some recommendations and some things we're going to be doing in the future. As I said before, we need to determine the cost of the cleaning process and determine the concentrations used, the contact times and whatnot. We're also going to add a third process stream. We haven't talked about converting AB type blood, but we plan on doing a little research into enzymes and then putting a third process stream up and running. We also plan to increase our market share of Japan's blood. Right now we're at 10%. Hopefully we can move up, who knows, eventually to 100%. And as I said before, we do plan on moving internationally to provide safer blood transfusions throughout the world. A few acknowledgements. Our team mentor, Michelle McNeilly, has helped us out throughout the whole process. She's been a real big help. Stephen Withers, the author of the paper that outlines the conversion process, he helped us with some critical questions that we had about the process. Michelle's colleague, Michael Zanellis, had helped us out a lot with some questions we had on filtration and whatnot. And lastly, we'd like to thank Professor ChE and Webster very much for all of your help and feedback. And with that, we'd like to thank you all very much and open the floor for some questions.
Excellent job.
Thank you.
Second, go back to your cost breakdown slides.
Which one? This one?
Yeah, this one. Do you have do you pay royalty or licensing fee?
No, we don't. So, as I said, we'd like to thank Stephen Withers. Yeah, we got in touch with him and asked him if there's any patent on it or if they have any licensing fees if we were to use it. And he said there's nothing. It's all out there just for the knowledge of everyone.
Okay.
Yeah.
So, well, you say you save on royalty, but what's the drawback on this?
Anybody else can do it. But, I don't know. I think we have a pretty good process. It could be hard to beat.
Because the first entrance advantage. So what if the Japanese Red Cross tell you that, well, we are in a very short supply of plasma? So they can give you red blood cells to do conversion, but with no plasma, say for the next 2 months.
If that were to happen, worst case scenario is we could actually buy the antibodies. It's a little more expensive than just buying the plasma, which is why we decided to purchase the plasma containing the antibodies. But buying the antibodies from a distributor is an option if needed.
And currently in Japan, they have an excess of their plasma. They do not do as many plasma transfusions, and they take the whole blood and really separate it out from the red blood cells and the white blood cells in the plasma. So they have basically the same amount of red blood cells as they do the plasma when they receive donations.
Right, so when you're separating plasma from the blood, you're actually getting enough plasma to do our agglutination process. because we actually don't need a 1-to-1 ratio of total blood, or a 2-to-1 ratio of total blood. We just need a 2-to-1 ratio of the unconverted blood. So if you were to get 300 liters of blood out of donated, you only have to take the plasma from 20% of those 300 liters. That will be enough to do our process.
Because the antibodies are only used for the agglutination process, we've already gone through our enzymatic conversion process.
So why do you still need to pay $6 million a year to buy plasma separately?
That's currently the price of what the Japanese Red Cross sells their plasma for. And as Sam mentioned, the actual A and B antibodies sold by a regular vendor are more expensive by a couple $1 million.
And it's the Japanese Red Cross is actually going to make more money after they separate the two, so they're more willing to sell us separately, and so they would do their separation and then sell it to us separately. Whereas if they were to sell us just the whole blood and we were to do the separation process, they would be getting less money, and then we would be spending more trying to separate ourselves. So it's kind of a win-win on each side because we don't have to do the separation process ourselves.
Gotcha. And one last question on QC.
Yeah.
So on the, you have a long list of the agents that we wanted to test. Is that done in your lab or done by the Red Cross?
Oh, go to Shikhar's. Couple more. This one here?
Yeah.
So these are all the blood testing that the Red Cross currently does, and we will maintain this standard as well.
So they will test the blood for these pathogens, and then when we receive the blood, just to have a safety check, we will also test the blood.
So you can do one more time.
Yeah.
Yeah, well, we're doing one before and then one after.
How expensive is for one test?
It's usually not too expensive. You can actually, this is just the expense in over here. You can send your blood out for, it's something like $30 to get tested. It may be a little more just because it may be a plethora of diseases that you can test for in this case. But, and you don't need to send the whole batch, you just need to send just a little small amount. So we're not wasting any of our product, and we're also, it's realistically $30, say we double it, $60 a batch isn't really gonna be that much.
That's a small fraction.
Yeah,
Right.
of the total cost.
Any questions? Thank you so much.
Thank you.
Congratulations. Outstanding job.
Thank you.
Thank you so much.